The world is changing. Inspiration is everywhere. It has never been so easy to connect, share, and bring people together. We're learning from others and finding the best in ourselves. Challenging our beliefs. Sharing our vulnerability. Overcoming our fears. Transforming ourselves so we can transform the world. How far can we go?
This is London Real. I am Brian Rose. My guest today is... This is London Real. I am Brian Rose. My guest today is Dr. Andrew KAUFMAN, the American medical doctor, professor of psychiatry, molecular biologist, and expert witness. You studied at Duke, MIT, and the Medical University of South Carolina, where you conducted and published original research and lectured to students, residents, and fellows. Throughout the COVID-19 pandemic, you have contradicted the mainstream media by stating that the coronavirus is not causing a new disease, that there is no evidence of increased mortality, and that modern medicine is the leading cause of death. Today, I'm looking forward to an uncensored conversation about the COVID-19 pandemic, the science behind the virus, and the global erosion of civil liberties. Dr. KAUFMAN, welcome to London Real.
Thank you so much, Brian. It's really quite a treat to be here.
I'm excited to have you. You know, before we get started, I just wanted to welcome you to the Digital Freedom Platform, and that's an independent technology solution that is of the people, by the people, for the people. It's available exclusively on our website. I just want to ask everyone watching now to please share this link via the sidebar and let people know what we're doing here. Doctor, I just want to say that I pledge to you that none of this will be edited and that anyone can watch the full version of this episode free without censorship or banning at londonreal.tv/Kaufman. Thanks to the generous donations of tens of thousands of people around the world, also known as the London Real Army. For anyone wanting to become a founding member of the Digital Freedom Platform, they can go to londonreal.tv/freedom to donate. Here at London Real, we've been a platform for free speech since 2011. And Doctor, I'm super excited to have you on today. And I think we maybe just jump right into it. And I wanted to know, what do you mean when you say that there is no evidence of the coronavirus causing disease?
Yeah, well, that's an excellent question. And what I've done is I've gone ahead and looked at all of the papers where there are scientists claiming to find evidence for a new virus, that they claim to isolate the virus. And I've basically scrutinized their procedures, and I've compared that to the history of how viruses and other diseases are proven to cause disease and how they're identified. So I've become familiar with the procedures and how they work. And what I've found is that the scientific procedures that have been utilized in all of these scientific studies are actually, it wouldn't be possible using those techniques to isolate a virus and purify it and prove that it exists. So what they've done really is they've done kind of two things. So one has to do with the genetic material, and one has to do with isolating a viral particle. So I'll talk about those separately. I'll talk first about the genetic material. So the general procedure that they utilize is that they identify someone with an illness that is unexplained, like this happened with the first group of patients in Wuhan, China, but it's been done in several other places around the world. And they have taken lung fluid from those patients, and they do this through an invasive procedure where they put a fiber optic scope through the mouth or nose down in through the windpipe into the lungs, and they squirt some fluid there and slosh it around, and then they suck it back up. And that would have basically a mixture of different things. It's a very impure sample, so it would contain, secretions from that area, like sputum. And it would also contain a mixture of different cells, such as our own lung cells and our immune cells. It would also contain various microorganisms that are present in our normal tissues, like bacteria and fungi. And then it also, lung fluid has shown to contain free genetic material as well. And then it would also contain what's called exosomes, which have their own genetic material. And I'll elaborate on what they are in just a minute. And so they took this sample of lung fluid, which has genetic material from many sources, and they added an enzyme that would digest any cell membrane. So it basically allows the DNA or RNA to be free in the solution so that they could do further analysis. And then they've identified a sequence of RNA that they allege is from a coronavirus or from the coronavirus family. But the thing is that since this sample is impure and has many sources of RNA, it's impossible to know what the origin of it is. If they wanted to be certain that it came from a virus, what they would do is take that lung fluid and filter it, because you can purify viral particles by filtration because they're much smaller than any other cells, even bacteria cells. And then you typically use a centrifuge with a density gradient that creates a tight band of these particles that's easy to suck up in a pipette. And then you could take those particles and extract the genetic material and say that it came from those particles. But when you have an impure sample with lots of sources of genetic material, you really don't know where it came from. So what their solution to this problem was is to compare the identity of the sequence of this RNA with other known RNA sequences. And they specifically compared it with the SARS-CoV-1 virus, which was the virus allegedly responsible for the SARS outbreak in 2003.
You say allegedly. We'll get to that, I guess.
Yeah, well, the thing is that they used the same exact procedures when they did the experiments for that virus. So in other words, they got the genetic material from an impure sample also, so it's not clear where the origin of that is. So you can follow this back in a chain to some of the original papers, and what I've found pursuing that is essentially the same exact procedures used each time. But how they said that this represented a coronavirus and was related to the SARS-CoV-1 virus, in fact, they call this virus the SARS-CoV-2, is that they looked at the identical nature of the sequences, and they found that it was just under 80% identical. And that's how they said, well, it must be related, and so we'll call it SARS-CoV-2. But the thing is, if you look at the genetic sequence between humans and chimpanzees, you'll find that there's 96% sequence homology or identicality. And so we are clearly not the same as chimpanzees, and no one would say that our genetic material is a part of the chimpanzee family. But yet they're using a sequence identity that has a much lower percentage, under 80% compared to 96, and saying that's a coronavirus because of that. So in my opinion, this is extremely weak science, and without purifying the lung fluid sample, you really can't tell what the origin of the RNA is. So they've used this sequence to develop the main diagnostic test that they're using, which is the PCR test. And aside from any problems using the PCR methodology, we simply don't know what it's testing for because we don't know the source of that genetic material.
Okay, so they're around testing people and they're getting back these results, and the results don't necessarily correlate to the person they're testing having anything that might be related to something that might cause a disease. You could get a quote-unquote false positive for other things in the past, including maybe flu vaccines or colds or a variety of things that happened to your past, and now they're qualifying you as COVID-19 positive? Is that right?
Yeah, well, it's quite possible that this RNA actually comes from our own cells. So a positive test could just say that we've measured your own RNA. I mean, the thing is, we really don't know what it is, and it doesn't seem to correlate with presenting with actual clinical illness. So lots of people who don't have any symptoms and didn't get ill test positive for this, as well as many people who are ill and have symptoms test negative. So since we don't really know what we're testing, in my opinion, we can't trust the results of this test at all.
And so, but there are people getting sick, dying, and now we're being told that they have been tested positive for COVID-19. You know, when David Icke was here, and by the way, he was here about 3 or 4 weeks ago, mentioned you in your research, which is why how you first got on our radar. He talked about the exosomes, which we can cover shortly. You know, he was careful to tell me how the language in the media never says someone died of COVID-19. They died after testing positive to COVID-19. And, you know, doctor, now it's become a meme where even the public seems to be catching on, where, you know, somebody, some wife shot her husband in her home because they were locked down because of COVID-19, so he died of COVID-19. I mean, it's almost not funny that it's become a joke, because the public seems to know that now everything is being overclassified as COVID-19 related.
Yeah, absolutely. And, you know, this is a really important thing to look at, because this comes from directives from our public health organizations and agencies. So,
Including
for
the CDC
example,
as well, right?
yeah, the CDC issued a special document that's a guidance on filling out death certificates. And they've essentially gone away from their usual protocols, where you want to have some certainty about the cause of death. And they've said that even if there's suspicion that COVID might be the cause of death, that you should just put that as the cause of death on the death certificate without any further scrutiny. In Minnesota, there was a directive that said if someone dies and you suspect it may be COVID-19 related, that not even to bother doing a test post-mortem, just label them on the death certificate as COVID-19. And then I also got a document, I think it was from the health commissioner or possibly the governor of New Jersey, a letter to healthcare providers. And it instructed them that in the usual procedure when there's a health crisis, that they normally would send bodies of people suspected to die related to the crisis for autopsy to the medical examiner. But it said in this case to not send any bodies to the medical examiner, to just essentially label them as COVID-19 deaths. And the only reason I could see that they would institute such a policy is that if they sent them for autopsy, they would probably find that they died of a regular cause. And this would affect the numbers in a bad way, in terms of if you're trying to create the appearance that a lot of people are dying from COVID-19. So what I've done in order, since you can't trust this data about the cause of death because of these instructions, what I've done.
By the way, just want to interrupt really quickly. I've seen interview after interview with these doctors talking about how there's no precedent of any kind of guesswork on an autopsy and on a death certificate. You just say the evidence. And yet this is the first time they're being encouraged to write down the COVID-19. And you hear doctor after doctor talking about how peculiar this is. And I mean, I've gotten emails from people here in the UK telling me of scenarios where they took in their 80-something-year-old, you know, grandfather with kidney failure. He was forced to sign a do not resuscitate order. He was told later he had COVID-19 symptoms. He died. Later, they were told he was never tested positive, but he was being qualified as a death of that type. I mean, we're hearing this over and over again. It's almost flabbergasting to hear.
One account where someone's child, I think they were a young adult, died in a motor vehicle accident. And on the death certificate, it said they died of COVID-19. And they were really upset because they had no legal recourse related to the traffic accident to, you know, file with the police or get reimbursed by the insurance company, because the death was recorded as being from COVID-19.
I mean, that's ludicrous. I mean, somebody told me, I think it was Dr. Buttar told me a couple days ago, that someone was driving a car with a face mask on, and he does not believe that those even should be used. Suffered from lack of oxygen, crashed their car, and it was COVID-19. Yeah, it's just hard to believe that's even happening.
It really is. And you know, there's so many accounts that I've heard directly from people speaking with me about this, that, you know, you combine that with the official documents and you see that this is going on. And so this is why I don't think you can accurately look at any mortality figures attributed to COVID-19 as being accurate whatsoever.
Why is this happening? Why would something like the Center for Disease Control, you know, ask doctors to fudge numbers to inflate the COVID-19 related deaths? I mean, on such a mass scale and at such a high level.
Yeah, well, you know, I'm certainly not advising the CDC how to proceed. So whatever I say would be somewhat speculative on my part. But in looking at what I do know about the CDC, one thing is that it is mostly funded actually by private industry. So there's something called the CDC Foundation, and you see that all of the major companies that represent the healthcare industry, such as pharmaceutical companies, health insurance companies, medical device companies, et cetera, are the financiers of the CDC. And they certainly have a lot of profit to gain based on having a serious pandemic and needing to sell vaccines or testing kits and things like that. I think the hospitals are in a different position financially right now. But it seems that all of the policies that they've initiated would have to be for the immediate purpose of inflating the perception of the health consequences of this COVID-19 situation. But it's definitely not grounded in reality. When I was in my 20s, I had a job for a couple of years. I was working for the New York City Department of Health, and it was in a CDC-sponsored position called a public health advisor. And my job was actually to go to hospitals and clinics around New York City and review charts to identify cases of AIDS. And I remember at that time, there were very specific criteria that had to be met in order to qualify a case of AIDS. And I would have to hunt down a lot of information in order to find out if the criteria was met. And if it was not met, I couldn't report it as an AIDS case. So the way that they are instructing people to report COVID-19 cases is a total departure from that approach, and it's very unscientific, and it's fraudulent in my opinion.
To continue watching the rest of the episode for free, visit our website londonreal.tv or click the link in the description below.